Welcome to RN Osce learning sessions. Today we will review the updated version of Station 3 focusing on specific physiological assessment. Let's start by reading the scenario carefully for 2 minutes. Here you are a registered nurse working in a neurology ward and you are caring for a so-and-so patient, and she was admitted due to left-sided weakness and sudden confusion, and she has been diagnosed with ischemic stroke. She has no history of any drug allergies. Vital signs are monitored and recorded. Our recommendations are: assess her level of consciousness by using Glasgow coma scale and evaluate her muscle strength by using muscle power scale. This scenario is testing your ability to recognize and prioritize care in patients with a neurological condition such as stroke. Perform neurological assessment, record and communicate findings effectively. Keep in mind that you have 8 minutes to complete this task, which includes performing both the Glasgow coma scale assessment and muscle power grading. Document the scores and address any concerns if raised. You have to make sure to spend the first 6 minutes properly by practicing by assuming the patient is lying down on his bed. This will help you to perform the assessment smoothly and effectively during your actual task. Once you enter this room, you can expect some questions from your patient. She may ask you that what for this assessment, or why you want to do this for me. For all patients you will do this. They are assessing your knowledge regarding this particular topic. As you know that you are admitted here due to weakness and confusion. It helps to measure your conscious level or how conscious you are. Or you can ask like this way: it's a neurological assessment tool used to evaluate quickly a person's level of consciousness after a brain injury. For all patients you will do this? No, it's for if we are suspecting or confirming any head injury or any CVA or intracerebral bleed, or after a seizure activity, or if you are undergone any neurosurgical procedures or any thrombolysis, or the patient is having any acute illness with unknown cause, or any unexplained level of unconsciousness, we will do this. What are the indications for doing this Glasgow coma scale they are asking for? So always expect some questions from your patient during your task. Moving further, as always, knock the door before entering the room, look around for scene safety, and always ensure patient privacy by closing the door. And before performing your assessment, you have to perform hand hygiene. Let's start. Hello, I'm your so-and-so, your nurse in this shift. I'm here to make an assessment on you. Is that okay for you? Okay, for that I am using a tool to assess your level of consciousness now. So I need to ask you a few more questions. Is that okay for you? Okay, thank you. Before moving further, could you show me your wristband? Okay, your name, date of birth, NHID is okay, so and so. Thank you. Shall I start now? Here, this Glasgow coma scale consists of 3 categories that apply to a neurological examination. Most of them apply to your brain itself, but some also can involve your spinal cords and nerves throughout your body. The first one is eye response. This relates to how awake and alert you are. You can see motor response. This part is about how well your brain can control your muscle movement, or by that way we can find a connection. Is there any issues with the connection between your brain and rest of your body? Finally, verbal response. In this test, how well your brain work, including thinking, your memory, your attention span, and awareness of your surroundings. That will be assessed. So, EMV response we will check. Let's see. So, you are already in the room. While approaching a person, usually you can see they may look at you. That's normal. So, check whether your patient is looking at you. If yes, you can give 4 points. Or if the patient is only responding to the sound, like, can you please open your eyes and look at me? Then only if the patient is responding, if you can give 3 points. If not, give a pain stimuli like a glabellar tap, that in between the eyebrows you have to give a tap. Only for unconscious patient that we are doing. If no response, then you can give 1 point. This eye response scoring is not testable if any edema, visible edema, any trauma or any dressing over the face, we are not supposed to perform this eye response. Moving further, you have to assess the verbal response of your patient. Okay, let's see. You are asking the patient that, can you please tell me where are you now? Which month is this? Or do you know who I am? If the patient is answering for any two, you can give 5 points. If yes, you can give 5 points. If they are oriented, you can give 5 points. If not, if they don't know where they are or what the date it is or who you are, then give 4 points. Slightly confused. Or if you asked for, can you tell me where are you now, she is replying like this way, like some place or name, the patient uses inappropriate words. Only words they are using, or only words they are saying. If yes, you can give 3 points. If not, only the patient produces abnormal sounds, not using any words, only sounds that patient is producing, we can give 2 points. If no response, that means if the patient not at all responding to any verbal commands or no response, you can give 1 point. In this also, it is not testable if the patient is intubated or factors interfering to communicate. The patient is having any disability to communicate, this test is invalid. Am I clear so far? Further, you have to assess the motor response of your patient. How? Can you please raise your hand, or can you please open your mouth? Okay, the patient is doing that, you can give 6 points. If not, give a painful stimulus like sternal rub or any trapezium squeeze. The muscle is located in the shoulder band. Patient always brings hands towards the sternum if you are giving a sternal rub. Or if you are squeezing the trapezium muscle, patient brings hands towards the clavicle. If yes, you can give 5 points. That means the patient is able to localize his pain. If not, if the patient tries to withdraw from the stimuli, like pulls their arm away from you while giving a pain in the fingertip, if you are just pressing her fingertip, she tries to withdraw from the pain. If yes, if she is doing that, you can give 4 points. Moving further, if not, the patient lies down in an abnormal flexed posture, like flexion, flexion and extension, you all know. Flexion means towards your body. Abnormal flexed posture after giving a painful stimuli. The position the patient is maintaining, we called it as decorticate position, like abnormal flexed posture after giving a painful stimuli. If yes, you can give 3 points. Instead of that, if not, the patient lies down in the external rotated position, like just opposite to that, after a painful stimuli. We called as decerebrate position. Decerebrate position. If not at all responding to any stimuli or complete absence of motor response, you can give 1 point. This is not testable if the patient is paralyzed. Am I clear now? Don't worry, no need to perform each and everything in detail, because as they given muscle power grading, it can perform only for patient is obeying commands. So one thing you have to keep in mind that you have to complete the task within the time frame. Okay? I explained in detail is because it's important for you to understand and be familiar with it. Once we done the assessment, you have to summarize. Okay, GCS score ranges from actually 3 to 15, with the 3 indicating a severe brain injury and 15 represents a fully alert individual. After my assessment, my patient scored so and so out of 15. So you have to summarize that. Okay, shall we proceed? Here, you are assessing the patient's ability to move. You are to ask the patient for, please push against my hand or pull towards you. If the patient can move extremity against that pressure you give externally, then you can give 5 score. If no, then again you have to tell that please push against my hand it again. With moderate pressure, we give externally. Okay, with moderate pressure she can move, then you can give 4 score. But without any pressure herself, she can move his extremity, means you can give 3 score. If not, ask them to slide his or her extremity in the surface. If she can perform that, you have to give 2 score. Finally, you can see only muscle contractions you can see, or you can identify with palpation or like flickering movements you can see, then you can give 1 score. No muscle contraction is seen or identified with palpation also, you can give 0 scoring. So in this muscle strength grading, you have to verbalize initially that please push against my hand. I have to perform your muscle strength grading. So once done, you have to summarize like this way. As I told you, it helps to assess the motor function. It helps to identify any neurological problems. We can track your rehabilitation process, and it also helps to differentiating the weakness in each extremity. Okay, I will update your treating doctor regarding your status, and I will be back after 1 hour for evaluation. This muscle strength grading helps to assess this motor function, and it helps to identify if you have any neurological problem, and also helps to track your rehabilitation progress, and helps to differentiate the weakness in each extremity. That's all for the reviewed station number 3. Now try practicing by imagining a patient lying in the bed and setting a 6-minute time frame for yourself. With proper practice, you will be able to perform this task confidently.